Emergency Center in Moorabbin. Today I have a very cute 11-year-old blind Labrador Retriever who has a history of this mass on the right elbow that's been progressively enlarging over the past 6 weeks. It had an aspirate done, which was consistent with a soft tissue sarcoma. We did a thoracic radiograph, which showed one little nodule that I was a little bit concerned about. So we went ahead and called the owners and got permission to do a CT scan. They consented. We did the CT scan, and it showed that there are several nodules in the lungs, but they're all likely to be pulmonary osteomas. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So I'm just doing kind of a narrow margin on this because it is thought to be a low-grade sarcoma. And the dog is 11 years old. I'm trying to avoid major impact on quality of life. And also with low-grade sarcomas, even with marginal excision, the likelihood of local recurrence is only about 11%. So this is the one situation where I feel comfortable in doing a less aggressive excision than I normally would. So it's also, the mass is freely mobile with the skin, which also gives me a little bit more comfort in being maybe a little bit less aggressive. So the radial nerve is going to be right about here. So I'll just have to be aware of that. The other thing I have to be careful about is not to cut the triceps tendon. You can take a little bit of it, but you certainly wouldn't want to take a lot of it because that will impact function. Can I get you to pull up that on that arm for me, please? Just a little bit. All right, so dog's getting light. Hi, California. Hi, India. Hi, Steph from California as well, I believe. A little bit of bleeding here. So again, because this is a low, likely to be a low or intermediate grade sarcoma on the extremity, we can be a little bit less aggressive with our resection. My concern here is going to be the deep margin. I might have you just retract on that for me, please, a little bit, just so I can get down to that. Skin margin. Where did I put my blade? Thank you. I would have. So I am only streaming on VetDojo. I'm not streaming on VetAlign. And that will be the norm going forward. Just a little bit of retraction there on that skin. All right. And I've got a sterile Sharpie here. I've taken just a normal Sharpie and I've sterilized it with ethylene oxide, which is fine. You can also buy sterile skin markers, but I find that they don't mark as well as Sharpies. So that's down onto the olecranon there. And again, I have to be really careful with the triceps tendon because I have had one dog where I basically shaved the tumor off the triceps tendon and it went on and ruptured. So I can take a little bit of the triceps muscle, so that's the lateral head of the triceps. I can take a bit of the triceps muscle without any concern, but I cannot take any significant portion of the tendon. So that's the mass coming off there. That's the underside. Dee, can you see the questions up there? I will do primary closure on this because I'm only doing a marginal excision and there's plenty of skin here. All right, so that's our surgical excision. That's the underside. We've got nice mobile fat underneath there, which means that our margin is going to be complete. Can I get some bupivacaine, please? And that skin's going to come together really nicely. So I will do a little bit of closure and a couple of layers just to get a little bit of tension off the skin, but I think that's going to be completely fine. So we'll just get some bupivacaine and infuse it into the wound. Hi, Canada. So Cartrophin, I don't typically use Cartrophin, but it's something that primary care vets often do. It's just something that I leave to the primary care vets to do the Cartrophin injections. Hi, Teresa from Oregon. I'll just get my plastic bag. My plastic bag is gone. So we'll just have to wait to... so the limb will not be immobilized. It'll just be like, it'll just have a light bandage. There's a question about anal sac adenocarcinoma. You cannot get wide margin on them. I do usually marginal excision. In dogs, interestingly, anal sac adenocarcinomas don't tend to recur. They tend to metastasize.
Do you know how much you want? It's like 8 mils.
Yeah, go for it. Yep. So you can't get wide margins on them, but they still tend not to recur. Cats do have or more commonly get recurrence.
Just the 8 mils?
Yeah, that's fine. There's a question about why they didn't get alert. So I'm only streaming this on VetDojo, not on Vetalign. Do you have a longer 25? Or a longer anything?
Longer? No.
I'll just do the 22 then. And I definitely do ink my margins. I don't use suture. I just use ink. The thought with suture is that you can tell what the dorsal margin was and what the ventral margin was and lateral and stuff. But my feeling is that if any of the margins are dirty, I don't really care where it is. I'm going to treat the whole thing like an open wound or like a new tumor. So I'll just inject into my skin. So we're pretty much always going to try to use some kind of local if we can, because that markedly reduces the postoperative pain, and local anesthetic is the most effective pain relief with the least number of side effects. So just going all the way around the edge there. Getting a little bit of splash into the wound as well, which is nice. All right. So you could do a axillary fold flap if you wanted to. Can I get some 2 OPDS, please? From here but we don't need it because we're basically using that loose axillary fold skin to pull it closed anyway. If you did rupture the triceps tendon, you really are in a lot of trouble. Basically, you have to try to get it to reattach surgically, and I find that to be quite challenging. And so certainly our best bet is to avoid rupturing the triceps tendon. So now basically what I'm going to do is I'm going to just divide the length of the incision and do interrupted sutures. And I'll do that repeatedly. So I've cut it into 2 halves, and then I'll cut it into quarters with my sutures. By dividing the incision into halves and then quarters and then eighths, it's much easier to get even distribution of the skin. So by putting in this deeper suture line, I'm just trying to reduce the tension that I have on the skin. I don't know if you guys can see the slip knots that I'm doing. Maybe I'll try to zoom in a little bit so you can get a better look. Just get a bluey. I'll try to zoom in. So I'm not worried about dead space. Steph, I am closing it, the dead space to some degree. Ideal is not to have a lot of dead space. Dead space a little bit. Basically, if you have dead space, you're just going to get a sarcoma, which is not ideal, but it's also not catastrophic. So now I'm dividing the incision into eighths. And watch as I do this slip knot. So I'm taking a bite here, a bite there. And what I'm going to do is I'm going to do a throw and leave it loose. Do another throw, leave it loose, right? So you can see that I've got basically a square knot. And I'm going to pull on the long end to convert it into a slip knot and then pull it apart to lock it. And that slip knot has much better tension resistance during the knot than surgeons' knots do. Again, this is a very lovely blind 11-year-old Labrador named Marley, and she's the sweetest thing. Has cataracts and retinal degeneration. All right, so then that's just going to pull across like that. Let me just see if I can get one more connective tissue layer there. Probably. Can I get some 3.0 PDS, please? Oh, sorry, 3.0 nylon, please. I'm not worrying about the dog ear at the end here. It's really just worried about getting a functional closure and getting a clean margin. And then when I do that loop, I'm going to pull on both ends of the loop to make sure that I've got it tight on both sides. And then just coming in with some cruciate sutures here. Make sure I'm wearing my glasses when I go to take these out because they're going to be tiny. I do not go to VMX in Orlando. I have been before. I usually just go to the surgery conferences unless I'm invited to speak. So I just went to ACVS in Belgium, and I'll go to, ECVS in Belgium. I went to ACVS a couple of years ago. Living in Australia, it is a bit more travel. To get across to the US for those conferences, particularly on the East Coast. Maybe I'll have this dog come in for suture removal when Malcolm's here. He's young, he can see better than I can.
Or you can just get seated.
Yeah, that's right. I really don't do as much CE, continuing education, as I probably should. Most of my CE I'm actually giving myself, so that's where I get all my credits. I try to go to at least one conference a year. And I can combine getting continuing education with giving it. That works well as well, because often when I'm giving CE, I get my travel and accommodation covered, and also the price for the actual conference, with the conference fees. It's nice to get that paid for. I'm giving a bunch of CE this weekend with Green Cross in Sydney. I'm doing a whole day wet lab on soft tissue surgical procedures. We're covering abdominal exploratory, axial pattern flaps, Z-plasties, flank fold flaps, gastropexies. And then I'm giving 2 lectures, one on hind limb lameness and one on second victim syndrome and the mental health challenges with having complications, which I've really struggled with myself. One more little suture. All right, so I'm just going to go and check to make sure I've answered all the questions. So I used absorbable suture in the form of PDS for all the deep sutures. So polydioxanone has a absorption profile of 50% loss of tensile strength in 4 to 8 weeks. And then I just use non-absorbable nylon in the skin because those sutures are coming out. I will not stream any more surgeries today because that's it for me today, but hopefully I'll have some tomorrow. So make sure make sure you subscribe to this channel. So it's interesting, I just got a report from YouTube that only about 30% of viewers on one of my videos were actually subscribed to the channel. So if you are watching, make sure you do subscribe so you will get that notification on your phone. So make sure you subscribe and turn on notifications so you'll get a ding in your phone when we live stream. Let's see. And let's see, a bit of a topic. Do you use cartridge in post-tubal? No, yeah, so we already addressed that. And that's pretty much it. So if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding in your phone the next time we live stream. So we did get a deep plane. That was kind of the fascia of the triceps muscle. I was able to remove that. So no more surgeries today. And that's pretty much it. Now with this one, I wasn't really pushing for wide margins because it is a low grade soft tissue sarcoma in an extremity. So even with marginal excision, you still only get 11% recurrence rate. So yeah, so that's why I didn't go for a huge margin. Anyway, if you haven't already done so, make sure you subscribe to the channel, and you can send a link to your friends to get them to subscribe as well.